Should we start? Hello, everybody. So here we are back again to talk about the COVID-19 vaccination programme this autumn. And it's been on the news today. We thought it would be, hence why we thought we'd come out to you. So we're just going to give everybody a minute or so to just give them a little more chance to join us. I know that people kind of always join a little bit later. So just a couple of, well, 30 seconds and then we'll start. 30 seconds always feels like a long time when we're waiting, but thank you so much for joining us, and yeah, hopefully we'll be informative. We have a couple of other people with us tonight as well, which I'll introduce in just a minute, and before I've known it, 30 seconds have gone by. So let's crack on. As I've just said, our programme tonight is about the autumn COVID-19 vaccination programme. It's been on this morning, it's been in the news today, all about what may or may not be happening. And as always, we're going to give you the truth to what we know today and what we're going to be doing. Now, remember, it is always subject to change. So as much as we tell you what is happening right now, believe me, it can change, but we will keep you updated. As always, ask questions. We'll do our best to answer them all to be able to do that. So you know how a live event works, and we're going to start introducing who else is here today. So we have Sally, who's here to answer any particular questions you have that relate to Sarum Health Group. So I'll just let Helen, who's producing, pass over so that Sally can give you a wave.
Good evening, everybody. Thank you for joining us. Thank you. Back to you, Anna.
Thanks, Sally. And now we'll also, oh, sorry, I thought it was going. Here we are. So I was about to say thank you and realised the computer hadn't quite caught up with us. And we've also got Emma Scott, who's our clinical director, with us as well this evening. So she'll be able to answer clinical questions predominantly.
Hi everybody, I'm Emma and I'm the Clinical Director for the PCN. Over to you, Anna.
Great. So there's 3 of us this evening, and hopefully we'll be able to answer all your questions. Some of you may know me, some of you may not. It may be your first time with us this evening. I've written my name is Anna Morton. I'm also part of Avon Valley Practice, and I'm also known as Miss OK. And Mary will know what I'm talking about, but many of you will as well, because in the heights of the pandemic, I used to stand here or sit here and say, right, okay. Okay, so and okay, I'm aware of that. So yes, I'll try my best, but I can't promise. And obviously it's my trademark. Right, let's get on. So what do we know? So we know that our vaccination programme officially starts on the week of the 19th of September. Now that's really, really important that you know that date. People are being vaccinated with the COVID vaccine this week, but they are people who are living in care homes or are working with older adults in care homes. They are our most vulnerable, and therefore they are being vaccinated this week. So you may hear this on the grapevine, but it is for people who are living in care homes. Next week, we will start expanding that out further, and at most a few people over the age of 80 may receive an invite from some places in the country. And but it's not guaranteed, because most of us, including our group, so that's Avon Valley Practice and Sarum Health Group, are receiving their vaccine the week of the 19th of September. Okay, so the week of the 19th of September, we will start vaccinating, and we will be vaccinating everybody over the age of 75. That's our first cohort of patients that we must prioritise. So it's our patients that are over 75. We will also be vaccinating frontline health and social care workers alongside that, and indeed any care home staff who haven't been vaccinated in the care home. That is very, very unlikely because of the programmes, but we have to be aware that they are our 3 groups that we'll be vaccinating. And due to our numbers and the amount of vaccine that we've been allocated as a group, it will take us 2 weeks probably to vaccinate everybody over the age of 75 in our practices. So we will be vaccinating week of the 19th and week of the 26th for patients over the age of 75 and those who are frontline health and social care workers. Again, they may well be being vaccinated in their place of work, but it's just to have that open dialogue. If they are registered with us, then of course you can be vaccinated with us. After that period where we vaccinated, or at least offered, all of our patients over 75 that vaccine, will then be going to the other groups. Okay, so that's what we called cohorts 4 to 9 back in all that time ago, January 2021, when we started vaccinating. So that's all adults over the age of 50 will be invited to attend, plus those who are aged 5 to 49 who are in a clinical risk group. Okay, and that includes pregnancy. And the best way of thinking about this is if you know that you'd normally be invited for a flu jab, you're going to be invited for the COVID-19 vaccination. It also extends to those people who live in a household with patients who have immunosuppression. And again, you would have been previously invited for a flu jab, so therefore you'll be invited for the COVID-19 programme. The difficulty here is that your medical records aren't always updated to reflect who you live with. So we have a limited amount of information on your records about that. So if you know that you live with somebody with immunosuppression, and you will know who you are because of the significance of somebody having immunosuppression, okay, then let us know when we start out in our next part of our programme, so in the first 2 weeks of October. Also, those people who are aged 16 to 49 who are carers will be invited in as well. So again, you'll be invited in to have a flu jab, you'll be invited in to have a COVID-19 vaccine in this autumn programme. Importantly, you cannot have had a vaccine in the last 91 days of COVID, so not a COVID vaccine. So if you've been a little bit delayed in the vaccines that you've been having for COVID-19 and you've had a booster or your first or second dose in the last 91 days, you cannot have your autumn booster right now. Okay, you can have it at some point, but not in this particular programme. Okay, now the exciting bit to this, which has been in the news today, is that they've been saying, well, of course, you'll get your flu jab at the same time. Now, at mass vaccination centres, that's not necessarily happening. In pharmacies, etc., it may or may not be happening because it depends on when the flu vaccine is coming. However, we've been really lucky and we've been told that our flu vaccine is coming the week of the 19th of September. Now, we don't know if that's Monday the 19th or Friday the 23rd of September as yet, but we're very much hoping that it will be with us in time to be able to offer you the COVID-19 vaccine and the flu vaccine at the same time. But it's always with a big but, because we are reliant on our supplies. So if we get it, we'll be offering it to you. If we don't get it, we won't be able to, and you'll need to go back to your GP practices to be vaccinated in a few weeks' time. But we wanted to be able to offer this service to you because, one, it's really convenient, and you get it all done. It's one trip out, done, sorted, and you know that you are as vaccinated as possible going into this autumn. So fingers crossed, we'll be able to offer you the COVID-19 and the flu jab with us. Okay, so that's what we know so far. Where will you be vaccinated? Well, we will be back at Lark Hill, but many of you will be very pleased to know that because we anticipated the dual vaccination, we very much hope, we had all our fingers crossed, as I said, we have got longer appointments, and we've also checked, double checked, and done everything we possibly can with IT. So we've got our best chances again going into this without the queues, spacing out to be able to do it. If you turn up to your appointment at the right time, okay. We often get bulges of people where they come too early for the appointments and then we end up with queues. And please don't, because if you've booked an appointment for 5 o'clock, please don't come at 1 o'clock hoping that you'll be seen earlier, because it just upsets the dynamic of the sessions. Please do come at the time that you're allocated. And as you can see on the presentation, the vaccines or clinics are steady. They're every Wednesday and Thursday for 4 weeks, and we should, fingers crossed, be able to vaccinate everybody in that 4-week period. If we can't, then of course we will offer some more clinics after that as catch-ups to be able to do that. But we very much hope that everybody that wants a vaccine will be able to attend and get this vaccine with us. Okay, if you can't make it, please cancel it in plenty of time so we can offer your vaccine to someone else, because all it does is delay the process for everybody. So we totally get things happen, absolutely fine, but please do tell us. Now, for many of you who are aged over 75, you would have received a text message last Friday inviting you to book an appointment with us, okay, to be able to do that. And those that haven't got text messaging, we have been slowly but surely telephoning you to be able to try and get an appointment sorted for you to be able to do that. Okay, so that's what we're trying to do, and get you all invited in. Once you've all been offered, we will then go to our next cohort of groups, and again we'll go to the over 70s within a couple of days, over 65s, etc., through the domains. When we get to after 65, we'll then go to everybody over the age of 50 and so on like that. But of course, clinical risk groups will be invited in after we've invited all of our people over the age of 75. So we will be following the national guidance on who should be offered the vaccine in order for clinical prioritisation. And lastly, at present, we know that we have Moderna. It's the new type of Moderna that's coming out to be able to do that, and that is not suitable for children. So if you're a child, then probably the best bet at the moment for speed is for you to go and get vaccinated at the mass vaccination centres to be able to do that, because we haven't been allocated the paediatric vaccination at the moment, and I don't want you to delay in the hope that we do. I'd rather you just get vaccinated. And that is what we know so far. Have we got any questions? So let me look to the side here and we'll start going through that. Okay. So somebody said, I am 74. Can I have my second booster before I go off on holiday on the 20th of September? No, not with us, you can't. I don't think the national booking system is also open yet for you to be able to make that that appointment. So unfortunately, I think the likelihood is that that's a no. Okay. Now, Sam has asked, do we know which vaccine? And I suppose at this point, it'd probably be quite useful to go over to Emma and ask her to just explain about the Moderna vaccine. Is that all right, Emma? Yep, Emma's nodding to me. So I'm just going to pass you over to Emma and she's going to speak about the vaccine. And I'm just going to look at your questions a little bit more. Okay, over to you, Emma.
Hello, yes, so it's the Moderna vaccine. It's the new one, if you've heard, whether there's a new one and the original one. This new one is a bivalent vaccine, which basically means it covers 2 variants. It covers the original wild type virus that came out at the very beginning of the pandemic, and it also includes cover to the BA.1, the Omicron variant, which you may have heard of more recently. So this one covers the 2 variants. It's considered to have a similar side effect profile to that of you having the original Moderna back in the spring boosters, if you had those. So the side effects are not to be considered to be any different. Thank you. Over to you, Anna.
Hi. So thank you, Emma, for that. If you have any questions, pop them in the group and we can always go back and ask Emma again. But there is another clinical question, Emma, for you. So it says, so Richard has asked, can I have my autumn booster vaccine the day before I go into hospital for spinal surgery, or should I wait post-op?
Hello, Richard. With it being a non and you're having the autumn booster vaccine, obviously you may get some side effects, but you will be covered. It would not affect your hospital procedure, but there is that chance that you may get some slight side effects if you've had them before.
Now, we don't know if anybody can hear us. Oh, here we are. Right. Oh. Okay. Right. I think we're back on. Emma, right, pass it back to me, Helen. Oh, Emma's back in. Okay, great. Sorry about that. Everything seemed to freeze. We seemed to have a complete malfunction for a moment or so, and you probably saw our frozen faces across the way trying to work out what was happening. You may or may not have heard us saying, back to me, back to you, back to me. Right, I'm going back to Emma for Emma to respond to Richard about spinal surgery. Of course, we always say with the caveat here is that if you're in any doubt, speak to your surgeon, speak to the hospital. But I'll pass you back over to Emma to give you an indication.
Yes, Richard, I think, or anybody just about to go into hospital, and I don't know whether you heard just what Anna said, but generally it's always a good idea if you've got any concerns to check with the consultant at your pre-op, or to give the outpatients and your consultant secretary a ring to find out. But they're not live vaccines, so they would be safe to have, although you have to bear in mind that if you've had side effects before, that you may well get them again, although hopefully very mild. So a little bit of a personal decision, I feel, but do check with your consultant or your if you need any further advice. But there isn't really a clinical reason not to have it. Thank you.
Great. Okay, thank you for that. Now, interestingly, we've just had a question in, but I seem to have lost it in the scope, and that was about whether or not you could go to Durrington surgery for your vaccination for COVID. Now, at the moment, we are working from Larkhill as a hub. Okay, we're trying to vaccinate as many of you as possible as quickly as we can, not only with COVID, but also with flu. Now, we may well need to offer some additional clinics as like I said, mop up. We don't know exactly when they are. We will have to work out when we can get vaccine from NHS England, what's happening with them there. However, if we need to do mop-ups, we will do our very best to have them at the most appropriate places. That may be Durrington Surgery, that may be at Millstream Medical Centre, but it depends in terms of where we are and what we're doing. And I think at the moment, you have to work on the basis that we are only operating from Larkhill Medical Centre at present. And you've got the dates, which I'll just go back to on my screen here so that you know when they are. So they are in the afternoons. The first appointment is at 1 o'clock from memory, and the last appointment is at just before 6 o'clock. So again, come at the right time, please, 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 because people get very upset when they think, well, I've come at my right time and I can't get in. And we're like, that's because lots of other people have come at too early for their appointments, and it's caused a little bit of, backlog and problem. So please do come at the right time. Now, I've got some other questions here to be able to go through. And we've got here from Sam, Emma. If you have COVID-19 and flu vaccines, is that a double whammy of feeling yuck?
Well, it's a difficult question to answer. It may well be considered a double whammy. It depends whether you normally are okay. I don't think it will be a double whammy. I think you'll just have two local reactions. I think you obviously might get a local reaction to the arm that had the flu, and then you may get a local reaction to the arm that had the COVID. So maybe some redness or some soreness. As to regards to the effects more systemic, so like feeling yucky, fever, headache, hopefully they won't be a double whammy. Otherwise, it should still be considered relatively mild rather than adding the two effects together and getting a double whammy. Hopefully it should be completely manageable, but we haven't done it before, so I cannot wholeheartedly say how you will feel. My apologies for not being able to be a little bit more exact on that. Over to you, Anna.
Hi, so someone else has said, I'm 43 and vulnerable. When would I be called for mine? So the anticipation is that after we offer the vaccine to everybody over the age of 75, we'll look at over 65s, over 70s, and those are clinically at risk to be able to do that. We've just got to check the numbers, but yes, we anticipate you being seen relatively quickly and offered your flu vaccine and your COVID vaccine at the same time to be able to do that. So someone else has said, if the flu vaccine is separate, will it only be at Lark Hill, as it's very difficult to get there without a car? Well, we're trying to make this as convenient as we can, but like I've said, we will be offering flu vaccines at practices, but after we've done the COVID-19 programme, to make sure that we offer everybody what we can when we can and use our workforce sufficiently, because remember, we still have to keep the day job going. We still need to offer and care for you for everything that is not COVID related at the same time, and it's a balance of the whole thing. So we're aiming to get you all vaccinated. The government say by the 11th of December. We're saying pretty much, well, as you can see, 13th of October. If we can get you all vaccinated in that time, isn't that brilliant? And if it all ends up being at Lark Hill with just a few of you that need to be vaccinated come the end of October, beginning of November, then that's what we'll look to do. But we've kind of step by step moving this through to be able to do that. So I'm sorry, it's a bit like Emma, you know, we can't give you a definitive of what is absolutely going to happen, but we've got a good position of where we are currently. Now, somebody else has said, am I able to get my injection at Lark Hill, as I received a letter saying I would be getting it done at home? Now that's a really good point. So we are aware of our patients who are housebound, so are unable to get to Lark Hill, are unable to get to their doctor's surgeries to be able to receive care. Now, that's based on coding that has been put into your medical record to say that you can, you know, you receive all your care at home. Now, to ensure that we could offer you all the services as quickly as we could, we have asked Salisbury Hospital through the vaccination centre to vaccinate those of our patients who are at home, who are housebound, to be vaccinated within their own homes. You've all received a letter to inform you of that service and asking you to reply by the close of play today if you do not want that service to be able to happen. Now, for you, if you are able to get to Lark Hill, then by all means book an appointment with Lark Hill. That's absolutely fine, not a problem. And we'll just make sure that, well, when somebody phones you from Salisbury Hospital and asking, you know, what date they can come round and vaccinate you, is please tell them that you've either already been vaccinated or indeed you're planning to go to Lark Hill in the date and time. So please just share that information wider accordingly. Let's move on. So these are all midweek and difficult for workers. Will there be any out of hours or weekend appointments? There are, but they are at the vaccination centres as they stand currently, and they have not opened up their appointments. They will be offering every day of the week in time to be able to do that. It's one of those things of trying to balance all the skill sets, what we need, when and how, and the number of people to be able to do that. So we've had to look at what afternoons we can do, what days we can do, and optimize our workforce accordingly. I appreciate that's more difficult for when you're working, but as I said in the height of the pandemic, but I still say it now, your employer has a duty of care to look after you and make sure that you are as safe as can be going into this autumn. If you worked for me, I would be giving you the time off if that was the only time that surgery was offering those appointments, to be able to go and get vaccinated. Because, you know, COVID, as much as it is becoming manageable and we are living with COVID, let's not forget how serious COVID-19 is still, if we don't have a good vaccination program. So employers have a responsibility, and you know, and we support anybody to achieve that. Okay. Let's have a look. I'm over 75. Oh, so Howard says, I'm over 75 and will be away during the September appointments. When can I book for the October dates? So we are looking probably at the end of next week, but again, don't quote me on this, to open up October's. But what we've been guided by NHS England to do is to drip feed the clinics in so that we maximise capacity all the way through. So we don't have half full clinics in September and more in October. So that's where they want us to kind of drip feed, fill up our clinics, and then open up some more clinics. So the more of you that can book, fill up the September appointments, we can then open up the October. But don't worry, if you are aged over 75, received your invite last week, can't join us in September, when the October dates are there, we will reissue the invitations again for you to be able to book. So I'm sure that you'll be able to get access. And then somebody said, we are going to be away a lot. Can we both come 6th of October, husband 73 and carer wife 64? Yes, the likelihood is you can get on those appointments when they get released, is my suggestion to you. And then just up here, somebody else has said, which is very, very sad to hear, I had my flu and COVID jabs at the same time last year and it was no worse than previous jabs. I was reading that to say, oh no, nuts. We had somebody with a bad experience. Indeed, not at all, smiley face. So get on there, have a look. Absolutely everything was hunky-dory and great. So yeah, everybody's symptoms are different, but good news story all round. So yeah, sorry for my misunderstanding. That's me reading and trying to present at the same time. Multiple juggling here to be able to do that. And then Sam just finishes off saying, not a question, just want to say thank you all for all you do in difficult times. Well, thank you very much, Sam, much appreciated. Now I can see another question and we're just getting to the end, and somebody said, I'm not housebound. Okay, so whoever you are that said I'm not housebound, can you contact your doctor's surgery, or indeed if you're happy, keep it reply telling us which surgery you're in and your details, and either Sally from SEM Health Group will arrange for somebody to contact you, or I will arrange for somebody to contact you from Avon Valley. So just pop that in the group and we'll get that sorted, but we won't publish it so that other people can see your details. Okay, don't want to have a data breach on our hands. So hopefully this has been really useful. You know the plan. Again, plan subject to change, but we'll do our best to vaccinate you promptly, get things sorted for you as ever, and know what's happening. So hopefully you've got a clear indication about what is happening to you, which is much more important than what is going on nationally and all the different stories that you hear in the breakfast news every day. So keep in touch. We'll probably do another presentation in 2 to 3 weeks if things change, but actually if you don't hear from us, the point being is that we're still on track, everything is the same. So use this presentation as the latest information until you hear otherwise. So thank you so much for joining again. Take care, and we'll see you soon. Many thanks.